Welcome to Med Surg. I've recorded this video to save us a lot of time on the first day of class and to make sure everybody gets the same information about me regardless of whether you had me in Med Surg 1 or you're just now having me in Med Surg 2. And these are things that I say over and over every single quarter, so it's worthwhile information. I hope you take the time to listen. Hopefully it'll only last about 15, maybe 20 minutes. First of all, let me tell you just a little bit about myself. My name's Megan McClintock. I've been a nurse since 1991. My clinical background is pediatrics, but I've worked in all areas of pediatrics: inpatient, outpatient, ER, home health, finance, and administration. Although pediatrics is my main clinical background, I have taught Med Surg and done Med Surg clinicals for quite some time. I've taught since 2006, so for quite a few years. I've taught fundamentals, Med Surg 1, Med Surg 2, and peds. Here at DSN, I've only taught Med Surg 1 and Med Surg 2 since I came here. I also created and ran a simulation lab in Oklahoma before I moved here, so I have a broad base of what you have been taught from the beginning, and so hopefully I can help you see how Med Surg ties in with everything else you've learned at this point. Really what I hope is that I can show you how what you've learned to this point that maybe at the time you learned it didn't mean a whole lot, how it can now apply. Generally, I love teaching because I love to see the light bulb come on in students' heads. I love to help students that are struggling if they really want to learn. I don't like helping students that want me to just give them the answers or just point out only what's going to be on the test, because you hold people's lives in your hands. I want you to be the best nurse, not the nurse who does the minimum to get by. I want to be comfortable with you taking care of me and my family, and I take that responsibility very seriously. So I'm going to push you very hard, but I will always be fair to you, and I will give you lots and lots of support and really help you as we go through Med Surg. So I've done this video to cover both Med Surg 1 and Med Surg 2, so I just want to compare those real quickly for you. And this is specific to DSN. Other schools do this differently. So for DSN, Med Surg 1 is the foundation for everything. We have moved some more difficult topics into Med Surg 1 to make sure that we are covering the majority of the topics that will be on the HESI that you take in Med Surg 2. Because Med Surg 2, we want you to build on that foundation. So Med Surg 1 starts out easier at the beginning to try to get your feet wet, and then it will stay difficult throughout. We will not ever slow down at the end because we're moving you straight into Med Surg 2. You do take a comprehensive final exam that is 15% of your grade at the end of Med Surg 1. Now Med Surg 2 is more complex, and all of the information is more intertwined. So we still learn by body system, but we expect you to remember all the things you've learned in Med Surg 1 and be able to apply them to more complex types of patients. So this will rely a lot on what you learned in Med Surg 1. So if you didn't get a good experience in Med Surg 1 or you really struggled, it is very, very important that you take time to go review what you struggled on, especially cardiac, respiratory, and neuro. These are foundational. I expect you to know all that information coming into Med Surg 2, and I'm happy to give you a list of everything I expect you to have learned in Med Surg 1 if you don't already have that. Med Surg 2 is more difficult at the beginning. We hit the ground hard from the very beginning with cardiac and then respiratory and endocrine and neuro, and at the end we do easy stuff, really Med Surg 1 stuff that we put at the end of Med Surg 2 because Med Surg 2 is such a busy quarter. It's lots and lots of clinical hours, on-site and off-site, and you have mental health. So you just have a lot to do. You have very little time in Med Surg 2, and certainly by the end of it you're very burned out, and we know that. So you've got to do well at the beginning because it's very hard for you to catch up. You've got to work hard even if you've got lots and lots of clinical hours at the beginning, because it will get easier at the end. But if you make a 50 or a 60 on an exam, it is very hard to come back from that in Med Surg 2. You do also have a comprehensive exam in Med Surg 2, but that is the HESI, the standardized test. You will take 2 of them. And they are 20% of your grade. I will prepare you for that as well as I can. We'll talk about that more once we're in class. Everybody always wants to know about my family, so I'll show you a few little pictures of my family. You probably will notice the accent. We moved to Colorado from Oklahoma in June of 2011, and we will never ever move back to Oklahoma. My husband, who you see in the upper left-hand corner and the lower right-hand corner, is an attorney who runs a virtual company. He runs the education part of a virtual company that helps estate planning attorneys across the country. So he works from home, which is really nice. My daughter in the upper right corner, that's Lauren. She graduated from high school in 2014 and is now at Colorado State University. She is a Palm Girl, which is a dancer at CSU, and was a Palm Girl at Evergreen High School. So we spend all our time watching dancing, because my other daughter, who you see in the lower middle and with her sister in the upper middle, is also a Palm Girl at Evergreen High School. She is in 9th grade. In 2014-2015, she's in 9th grade, and she does dance too. So if you watch So You Think You Can Dance, which is one of my favorite shows, you'll know who that is in the bottom middle with my daughter. That's Twitch, who she met at a dance competition in California this summer in 2014. Both my daughters are very accident prone, so you'll hear lots and lots of stories about them because we've experienced lots of medical problems at our house. My family, way more fun than me, so you'll hear about my family a lot as we go. My dog that you see in the upper left and the lower right, his name is Apollo. And I love him as much as I love my 2 daughters and my husband. So he's very important to me. You can see him in all these pictures here. We do live in Evergreen, which is beautiful, beautiful little town west of Denver, out in the mountains. We have lots of wildlife, lots of elk, lots of deer, foxes, and as you see in this picture, bears. We love the bears. We see them outside our door fairly regularly in Evergreen. So if you have me in the fall and winter, sometimes it's a little bit tricky getting here with the weather. But they cleared these roads really well, so I'll be here or I have another plan always. So that's my family. So now on to the details. A little bit of housekeeping things, just some rules for my classroom. You need to check your email daily. That's the only way I have to communicate with you. So if you're a person who doesn't check your email, you are going to miss out. And sometimes that's on some really important things, and sometimes it's on some things that will help you on the exam or on the quiz. And so you need to learn to check it daily or have a friend that's going to help you with that. Also, we are really asking you not to print this year. So we used to print things for you. I am not going to be printing anything at all for you. And we really want you to try to not print. Just, to stay green and try to learn to take notes on paper and take notes on your laptop. Now, I know this is not going to work for everyone. Some of you definitely need to see things in print and be able to write right on there. And that's okay if you need to. I'm just asking you to think about that and try it another way if you can. I do send out my PowerPoints. The PowerPoints that are on Blackboard may be old, and we're updating them regularly. but they'll be close to what I'm going to do in the classroom. I do also send out all of my instructor notes, so everything I say in class will also be in notes through a PowerPoint file that you can access. And again, it's not necessary usually for you to print it. You may just want to read it and then add that to your handwritten notes. So feel free to use your laptop in my class for taking notes, or feel free to take notes by just handwriting or just listen, because again, everything will be available for you. So for some people, it helps you just to listen. Also, feel free to record my lectures. This is not going to be helpful for you if your learning style is not an auditory learning style, but if that is your style, which it is for a lot of people, feel free to record me and listen to it again. And so the two rules I really have in my class are related to that. Please do not talk to each other during class. The reason is lots of people record my lectures, and when they record, they hear you talking instead of hearing me. And so all that ambient noise makes a big difference. I can truly ignore you, even though I can see you talking from the front, but your classmates will ask me to do something about people talking because they can't hear the recording. So I'm warning you now that if you talk in class and it's disturbing me, or I think it's disturbing recording, I will call you down in class. And I don't like that. You don't like that. Everybody gets embarrassed. So please just don't do that. Also, do not play or text on your phone in class. The DSN catalog says that you can't even have your phone in class. I'm not going to do that. But if you're just sitting there laughing and showing people your stuff and looking down in your lap, you're on your phone. And again, I can see that in the front, and sometimes that's very distracting. And it's not something, again, that you want to be called down in class, because that's embarrassing. So please respect me, respect your classmates. That's all the rules I have. Everything else is going to be helpful tips for you. So the Blackboard course materials, Blackboard, you know, is fairly new to DSN, and we may have some issues, but just let me know. If you can't access something, something's not working right, let me know. We'll get it fixed. I want you particularly to know about the course materials. So there's several sections in there, and I just wanted to mention what each one is. Lecture notes includes old audio files that I have done before, like lectures maybe I was going to miss and I recorded it, and tutoring files. So this is for both Med Surg 1 and 2. Not every subject is covered, but if you need to hear something again, maybe hear it in a different way, that would be a good place to go and look. I don't record every lecture, so they are not all out there, and again, that's not all live lecture material. Documents, I like tables, and I will refer you to tables a lot, and I create them for you to try to help you condense this information. So some of those are out there. There might be some games out there. In the other section, I have put a dosage calc review PowerPoint that I've used in the past. Don't freak out if you utilize that, because there are some things in there that we don't test you on. You can just skip that. So I will send out an email telling you what we'll test on, and then you can skip the other thing. The answers to the practice problems that are on that PowerPoint are in the instructor notes. So they're all there. I also have additional calc practice questions. If you need them, just let me know. The web links section, these are videos that are actually on my personal web page, which is pocketprofapps.com. There's just a few out there, and we link to them in case you want them. PowerPoint section, the PowerPoint section are files from last quarter. I will update those usually weekly. There may be a little lag in how quickly we get those on Blackboard, so we'll work that out as we go. My PowerPoint files I update every quarter, but they don't always change significantly, so you're fine if you utilize those. I just may be in a slightly different order. I may streamline things in class. The test prep section, these are PowerPoints and audio files that I have recorded with test taking tips and learning style and study tips. If you fail an exam, I'm going to ask you if you have reviewed those, because I say the same thing over and over to students, and I'm going to expect you to review those before you come meet with me, just to save us both some time. It's there for everybody to use. It may not be there for Med Surg 2 on the first day of class, so I will get that added as soon as I can. Med Surg 1, we will actually go over that material on the first day of class, so you don't need to listen to it. It will be there for your review later in the quarter if you need it. And then the last thing is clinical materials. These are everything you need for your clinical rotation, and it's stuff that the clinical office has added in. So now that I've probably scared you and made you feel a little overwhelmed, let me give you some tools to help you succeed in Med Surg. So here's some studying suggestions. Again, these are things that I have told students quarter after quarter and that students have told me. So really we're just trying to save you some time by not having you try to figure it out, but telling you what we know works. So you need to prepare before you come to class. So I get it. These are long chapters, and I get that you may not read every page of the book. And for some people, the reading just doesn't work well for you anyway. But please hear me. I promise that you will retain more in class if you have done something before you come. So the easiest thing for you to do is to go to your Evolve chapter summaries. They give you key points and an outline. You can get that in an audio file. You can get it in a printed file. It doesn't matter how you do it. Please read it or hear it before you come to class, and you will retain so much more. What happens is your brain starts processing the material, and by the time I'm explaining it, you already know what questions to ask. If you do not prepare before you come, your brain will not process the material that I'm sharing with you until we're already done and moving on to another subject. So that is the biggest, most important thing for you to do to retain the most information from class. Also, please come to class and pay attention. I don't have a problem with students coming to my class. I will send you a file of advice from students from previous quarters, and you will see the majority of them say, just come to class. My style is to cover everything that will be on the exam in my class. I cover additional material too, but I have my exams prepared before class. I highlight what's on my exam in my notes so that I make sure it gets covered. So the best thing for you to do is to come to class and pay attention. So take notes, whatever works for you. Also, feel free to ask questions during class. I'm very easily interrupted and very easily will get right back on track. Doesn't bother me at all. Now, if you ask a lot of questions or a lot of personal stories and it's getting us off track, I may talk to you about that later, but generally it's fine. Ask questions, please. Also, please don't cram. You have too much material to cram, and you need this material for the rest of your life. Med Surg is the foundation for everything you do in nursing. It's going to be the majority of your NCLEX licensing exam, so you cannot just cram it and then forget it. We will continue to use it over and over. So study a little bit every day. The study guide. I give you a study guide for every exam. I give it to you the first day before all the units we're going to cover pretty much. You want to do it. Nobody ever regrets doing it the first time, and they do regret if they don't do it. It is very, very big. So let me explain how I do it, and it is not required for anyone. So what I do is I use multiple test banks for my exams. Multiple different books, not just the Lewis book that we use. I choose possible exam questions from those test banks, and then I write a broad question that addresses that topic. That's what's in your study guide. So there may be 250 questions on the study guide, but there will only be 50 questions on the exam or less. Everything on the exam will be covered on your study guide. But it's not black and white. The answers really need to be in your own words. They need to be something you understand. If you're just putting my notes directly off the slide onto that study guide, you're not going to be able to apply that information, and the questions are asked where you have to apply it, not just have the information memorized. Also, the most important thing about the study guide is for you to do it all by yourself. Feel free to share your full study guide with someone else, but do not split it up with a group. Here's the thing, when you do that, you are relying on someone else's information to tell you what to study. And maybe they don't pick up on the key points I discuss in class as well as you do, but you let them give it to you for your studying. It's really, really important that you do it all by yourself. And then I would love for you to share it with each other, because when you read someone else's notes, it sometimes makes that information sink in a little bit better, but sometimes it doesn't. That's why you need to do it yourself. Also, do NCLEX questions every day. We require those. You have to turn in 25 a week. We turn them in with exams. But keep them going every day and do the subjects we're working on in class. This will help you the most for tests. It will help you the most for HESI prep. Finally, do not memorize. I've already mentioned this. You have to understand this material. Sometimes there are things you just don't understand. Endocrine is really hard for a lot of people to understand, and you may find you have to memorize that. And that's okay. If it's one subject you have to memorize, that's okay. But if you're finding every subject you're memorizing, you are going to struggle. So really, really important that you understand the material. And I'll give you lots of ways to do that. One of those is YouTube and Google. These are your friends. When you get a subject you don't understand, let's say we're talking about cardiac cath, and it just doesn't make sense to you, go Google it. And look at patient education sites and look at YouTube videos that show how it's done, and then maybe that will help you understand. Also, as you've probably already noticed, lots of diseases are alike. So it's really important you don't memorize every little thing about a disease. When we talk about GI, every one of them has pain and nausea or vomiting, diarrhea, constipation. No point in writing that down or memorizing it. Just learn the key defining features, and that's what I do for you a lot of times when I'm giving you those tables. Also, lab values. Don't memorize ranges. Memorize the middle number, or if we always have a problem with it being high and we never worry about low, memorize the high number. But don't memorize two numbers, the lowest and the highest, because that's more that you have to keep in your head. Let me give you some studying tips. Read through your notes and my notes, the instructor notes that I include in the PowerPoints, and highlight only what you don't know or what you're confused by, and spend your time on that. Here's the problem. People tend to study what they already know because it makes you feel good and you feel better because I got that. But it's the stuff you don't know that you need to spend your time on. So you've got to be efficient, especially in Med Surg 2 with limited time. So only study what you don't know. Look at confusing concepts at patient sites. Sometimes just hearing it from a patient perspective helps you understand. And the ones that are good are Mayo Clinic, WebMD, eMedicine. Also, I mentioned this already, if there's a topic you really can't grasp, then memorize. But know that you've got to allow extra time for that with HESI prep and NCLEX prep and final stuff. Try studying with others. A lot of people hate that, but for some of you, that's really the best way. And if you're auditory, that helps for you to discuss things. If you're a kinesthetic learner, do your case studies, even though they're not required in Med Surg 2. The workbook has a lot of great material, and a lot of people have found that helpful for testing and for HESI. It's really important that you know your learning style and then focus on that when you're studying. One way of studying doesn't work for everyone, and so it will save you a lot of time, make you a lot more efficient if you study based on your learning style. So if you didn't have me for Med Surg 1, go review the learning style video where I try to help you with that. If you are in Med Surg 1 right now, I'm going to review that the first day of class. But it's really helpful for you guys to go review that. Testing. My testing is very straightforward. However, it does require critical thinking. You should be used to that from Med Surg 1. Judy Lawler teaches the same way. But I'm just telling you, you can't memorize data. You got to be able to apply it. I do always cover everything in class. I've mentioned this before. You cannot expect every teacher to do that. That is my style, and that's what I do. So usually after the first exam, you will trust me on this, and you'll recognize I mentioned it all in class. But you have to decide whether you're going to trust me now or not. Again, that test taking tips and the test taking problems video, I'm not going to cover those in detail here because I've got those on a separate video. And in Med Surg 1, we will cover that the first day of class. If you had me for Med Surg 1, we have covered it, but you could watch that video to hear it again. If you are struggling with testing, please meet with me sooner rather than later. If you know for sure that you bombed the first test because you didn't take enough time to prepare, then you probably don't need to meet with me. But if you're not sure why you failed, or it's the second test and you failed again, we definitely need to meet. And the sooner we do that, when the information is still fresh for you, the better. I've kind of mentioned this slightly, but I'll emphasize here that memorizing the study guide will not help you. You have to understand the information because it's not black and white and it's not tested that way. Do not get behind. You will have a hard time catching up. And don't forget that this material is covered on your HESI. And in Med Surg 1, it's covered on your finals. So you cannot forget anything we're teaching because this is the foundation for everything. Cheating, you know, we can cover cheating more on the first day of class, but I'm just telling you, don't do it. You hold people's lives in your hands. It's really important that this information, that you learn it. If you cheat and I catch you, I will recommend the harshest punishment because you just shouldn't be cheating. Most people cheat because they run out of time. And so if you run out of time to prepare, you just need to suck it up and get the grade you get and then work harder the next time. Because if you cheat, it's awful if you get caught. Test banks, if you have them, that's cheating. So if you have them, you need to get rid of them, and you need to know that I use multiple test banks and I modify my test questions. So sometimes that means just modifying one word that makes a different answer the most correct answer. So it doesn't help you to use those test banks either. And by the way, if you see people cheating, you should report it. This is important for you to learn as a nurse. You're going to be faced with those kind of ethical dilemmas, and you need to be willing to report all throughout nursing school. A few testing tips. Again, these are covered in detail on my videos, so I'm not going to cover them in detail here. I'll just give you some quick ones just to kind of wet your whistle and get you wanting to watch the other video. When you don't know something, don't panic. You know more than you think you do. Go back, read that question again, and look for clues. Really important to read carefully. Underline keywords to keep you focused. Don't change your answers. The only time that's okay is if you have thought of new information. Really important, the foundation of testing is to make sure you know what the question's really asking and then to know what those answers really mean. And we'll practice some of that in class. A couple of things I've seen coming into my class. You've been told sometimes that you never ever call the doctor. And I'm telling you now that that's not true. So I give you some examples on the testing tips to help you understand, but notify the doctor is sometimes the correct answer. Also, risk for, you were taught early in fundamentals that risk for diagnoses can never be the highest priority, but that was fundamentals where you were learning the basics. Now you're going to understand that sometimes risk for diagnoses are the most important and the highest priority. And so you'll get more of those tips if you watch that video, or for Med Surg 1, you will get that the first day of class. And lastly, I want to tell you how I handled testing. Just so you know my rules when we test, I control your seating. Because we are in such small, cramped classrooms, I don't want you to be sitting by somebody that might tempt you to cheat. So I just randomly assign your seats. So I will make name tags, and then I put the name plates out right before the exam so that you know where to sit. Sometimes I don't open the classroom door for exams until right when the exam starts for various reasons. So you just have to see if there's a note on the door, and then if you are waiting in the classroom before the exam, then I'll ask you to stand up when I set out this seating. And we will stay in those seats until after we have done exam review. So we'll test, you'll leave the room until everybody's done or we've met the end of the testing time. Everybody will come back to those same assigned seats. We'll do exam review, and then I'll take your exams up, and then you can go back to your regular seats because everybody wants to sit in their own spot, and you can certainly do that after we do exam review. You can have nothing at your desk during exams but water and a pencil. And you will put your backpacks or anything you bring in with you at the front of the room or the back of the room. Also, do not have phones on your body. Don't put them in your pocket. Put them in your backpack away from the testing area. And that's just so there's no way we can accuse anyone of cheating. We also have no bathroom breaks in testing, and that's for the same reason. We have had too many problems with people going to the bathroom and calling somebody or looking something up. So you will not be allowed to go to the bathroom. Make sure you do that before the exam. You don't wear your DSN name tag for exams because there's lab values on the back, and particularly in Med Surg 2, but also sometimes in Med Surg 1, I expect you to know some lab values, so I don't want you to have that there to tempt you. We do review all answers after the exams, and then I give you about 30 minutes to ask me questions. And it'll be less if you don't need it, more if we need it. But I allow you to ask questions, and we use that as a learning time. I do want you to know that I do hear what you're saying. I change wording sometimes, but I only accept additional answers based on the exam statistics. So we will not know what that is until we've run all the exams, and then I will email and let you know if I took more than one answer on any questions. If you fail an exam, you will be sent an email from me, and I will ask you to complete a failed exam questionnaire. This is only for me to find and for you to think about why you failed that exam, and that will help us know, do you need an appointment with me or do you not? No one has to make an appointment with me. But if you do not choose to fill out the failed exam questionnaire and you fail the course for some reason, you won't have much to appeal if you didn't respond to my offers to help you. So I won't chase anybody down. I won't beg you to come meet with me because I can't do that with the 120 students. But I'm more than happy to meet with people that need to meet with me. And so the failed exam questionnaire gives you and I both an opportunity to figure out whether you need to meet with me or not. It's just really important that you do that quickly. Otherwise, then the next exam is on us because sometimes we're taking weekly exams and we don't have time to meet. All right, just two specifics for Med Surg 1 and then Med Surg 2. In Med Surg 1, we require case studies to be done. They're turned in before each exam, so on exam day, you will turn in your case studies. We might do that electronically. We might have you print it. I will let you know that. In the syllabus, it will tell you which case studies are required. It's usually 2 before each exam except the first exam. The purpose of these case studies are to help you apply the information you're learning in class. So we want you to see how valuable the case studies can be. So for some people, this is a great way to utilize studying with your learning style, and for others it's not the best, but we want you to try it. So that's through the HESI site. And again, you've got the list, and you can get the highest grade you want on that. So take it as many times as you want. I am only going to take the highest grade, not the average, but the highest. And so when you turn them in to me, highlight your name, the case study name, and your highest grade. I will not accept these late, so you will get a 0 if we're done with the exam and you haven't turned them in. So it has to be turned in on exam day. Also, please don't do them in advance. The whole purpose of these are to help you prepare for the exam. So if you're doing them, 4 or 5 weeks in advance, you're not doing them when you learn the information, and it's not meant for you to just do them over and over to get the best grade. It's meant to see, can you apply what we learned in class? So it's better for you to do them after we've covered the information in class. For Med Surg 2, you do not have to do case studies this quarter. Some of you will be thrilled, but feel free to do them if they worked really well for you. But you will be doing HESI prep quizzes. A lot of what we do in Med Surg 2 is trying to get you prepared for HESI midway through. So that's what these quizzes are for. They are focused more on Med Surg 1 information than prepping you for your Med Surg 2 exam, although it will have some Med Surg 2. So for example, exam 1 in Med Surg 2 is cardiac. Your HESI prep quiz will be cardiac only. Sometimes you will have more than one subject because of where things fit in. But for cardiac, it's just cardiac, but it will be mostly Med Surg 1, hypertension, coronary artery disease. Well, we cover that in Med Surg 2, but that kind of stuff, and the drugs, that kind of stuff. I give you that quiz pretty early, usually with the study guide, and the quiz is due prior to taking the exam. So you bring it on exam day, just like you did with case studies, and you're going to turn it in. Usually on a Scantron, you'll keep your original. We'll go over the answers after the exam. We may try to do some online. I'll let you know if we do. Please do these quizzes the way they're designed. They are designed to make you see what areas you're weak in, things you might have forgotten from Med Surg 1 that we know they test on HESI. So first, try to do the quiz on your own with no resources. Don't look anything up. Don't do it with anybody else. Do it alone to help you see where you're weak. Then you can look up any answers you're unsure about. You can compare answers with other people. I want you to get a good grade on these. These are designed to get an A on, but they're also designed to help you see where you need to study to get ready for HESI. So please use them in that way, or you're wasting your time. So I'm not stupid. I know you can do it together. I know you can go onto Quizlet and type part of the questions. These are not test bank questions. These are HESI prep book questions and NCLEX prep book questions. So I know they're out there. That will defeat the purpose if you do it that way. So please do it the way I'm asking you to do it. Again, I will not accept these late. They have to be in before the exam because we go over them after the exam's over. Just a couple of quick things and then we're done. As instructors, we don't always make it clear as to why we're assigning something or why we have certain policies, but I am more than happy to answer any questions about anything. Just like some of you see a pretty young lady in that left picture and some of you see an old woman with a big chin, things are just not always like they appear. Just like on this right picture, that's really just a car painted onto the van. So we need to remember that perception is reality to most people and seek clarification of your perceptions. Please don't start rumors and cause anger in the class. If you have a concern, just clarify with me. I am more than happy to answer things. I'm more than happy to explain why I do things. Just ask me so we don't have issues, please. Critical thinking is really my biggest goal in Med Surg, is to teach you to critically think. It's so important. I know you feel like that kid on the right that says, I can't stop thinking, but it's really true. As a nurse, you can never stop thinking. You're the one who catches the problems, and the doc may come in and save the day, but you're the one who called the doc and asked him to save the day and recognized he needed to save the day. I know you also feel like the cartoon in the lower right that says, why don't you just tell us what's going to be on the test? But you really don't want to be that kind of nurse. It's very important that you can think through things. You're learning a huge amount of information, and it's all important, and you can't possibly memorize it. So it's really important that you can think and that you can reason. And that's what I want to try to help you learn. Finally, the cartoon on the left, I know you get frustrated by different instructor styles and pet peeves. However, that's just how it is. I will always try to be as upfront with you as possible. You're going to hear me say probably 100 times, this isn't going to be on my test, but it's important for NCLEX and HESI, because I think you appreciate that as you get closer to that. So we do that not to irritate you, but to help you. So again, remember, I always cover test questions in class, and many times I emphasize certain information. I even will kind of cover some of those distractors and wrong answers for you, so it's really important for you to pay attention in lecture. I love this slide, this cone of experience, because I think this helps you understand why we do what we do. So if nobody's explained why we do some of the things we do, give me just 2 minutes to explain it. If all you do is read for class, you're only going to retain about 10%, as you see at the top of this pyramid. If all you do is come to class, you might retain 50% because you're hearing it and you're seeing it. And if you take notes, that's going to increase it even more. But if you do, and that's clinicals, on-site, which is simulation, and off-site, your clinical experiences, you can retain up to 90% of the information. But that's going to require some work on your part because it's not all tied in with lecture. So when you experience something in clinical or sim and we haven't covered it yet, then you've got that background for when we cover it in class, and vice versa. If we've covered it in class, now you can try to apply it. And ask, when things are presented differently by one person than another, ask why. And so we can learn from that. Ask me. I'm always more than happy to tell you, and we all learn from that. I think this is the last thing, is the syllabus. We are not going to cover the syllabus here, and we're not going to really cover it in class. I expect you to know the syllabus, and I don't put a lot in there, so please take the time to read it. Because if you miss something and it was in there, you're still responsible for it. So please take time to look at that. I can't wait to meet you on the first day of class. I can't wait for us to be together this quarter. Please feel free to email me, ask me any questions that you have. See you soon.